So I'm going to talk to you about some of the work we've been doing in the United Kingdom with the National Institute for Health Research. The National Institute for Health Research is funded by the UK departments of health, so we really plug into health, public health and social care services in the UK. And I'm going to talk to you and give you kind of our 5 top areas that we've been thinking about and working on in terms of the agenda of integrity in research, responsible research practices, avoiding waste, and, as we refer to it, adding value in research. The first one is to understand your purpose. The reason this is important is that the activities that we do on a day-to-day basis are often disconnected in time, sometimes by a very long period of time, 10, 15, 20 years, to the ultimate purpose we're trying to achieve. And for NIHR, as I say, we're funded by the UK Departments for Health, and so our purpose is about improving the health and wealth of the nation. So the kind of people that we care about when we make our decisions on a day-to-day basis are patients, our public, our health service professionals, those that benefit from, use and deliver our health, public health and social care services. It's really important to us to keep those in mind, particularly when there is this such long disconnect between when the research is initiated and when it has impact. This is a slightly controversial point, but I would argue that when you think that through, we don't need less bureaucracy, as is often the clarion call, particularly of the research community, but we do need smart bureaucracy. We need to purpose that bureaucracy in order to achieve our ultimate purpose. And in other words, create a logic model that connects you to your purpose and make it useful on a day-to-day, month-to-month basis. So we want to get what are the flow of activities that we need to do in the process in order to achieve our end goal. Now, we think about these in 3 broad areas, which I think are entirely in tune with the themes of this conference. That's about relevance of the research. It's about quality of research still. That still is a fundamental principle of what we do, but it's also about openness. Now, as I say, our intended goal is this stuff at the right-hand side. It's about impact, it's about benefits to health and well-being, about knowledge and the research process and the wealth of the nation. And that's delivered through various outcomes, and I clearly haven't listed them all, but it's things like changing service guidelines, changing the knowledge base, and changing research methods. Now, those areas are largely out of our direct control. They're done by other agencies, other players in the system. What we have some control about is the inputs to this model. It's about the costs, but it's not just about money. It's about the opportunity cost, it's about the time, it's the enthusiasm of patients and the public and the clinical community that help us along the way, and it's about our political and fiscal support that maintains our funding. The things that we really do is the stuff in the middle. That's the processes. They're the things that my team have to worry about on a week-to-week, month-to-month basis. Yet the things at the end that we're trying to achieve take many, many years, 10, 15, 20 years to achieve. So we have this framework which allows us to make decisions in real time, which we, through this model, believe will lead to impact. The key things around this is that we define value as impact for a given cost. That links it directly to our broad mission. And that in delivering this work, we believe that it raises the probability, and probability is an important word there, the probability of impact at the portfolio level. It doesn't tell us anything about an individual project moving through the system, but the probability of the portfolio, we think, is improved. Now, the other thing about this is we have to measure. We have to go back and see whether or not we're doing the right things. And I would argue that we can measure fairly easily the input costs, fairly easily. Some of these things are hard to measure. We can measure with proxies the things we do in the process in the middle. It gets harder to measure outcomes, and I would argue it's nigh on impossible to measure true impact, or at the very least, to attribute that impact to any work that we've done. So we need to keep that in mind. So number 3 is focus on relevance. So the key thing here is to set priorities with the intended users of that research. Think about who we're trying to generate benefits for impact at the end. So for us, it's patients, public, carers, health professionals. They're the ones that we ask to set priorities. For others, it may be other end users of that research. But don't just do this with the research communities. So one way in which we can illustrate this is this is a fairly kind of famous study which looked at, if you asked what the patient priorities were around, I think this is osteoarthritis of the knee, in the red bars, and what trials are actually being done, there's a disconnect. So majority of trials are in drug interventions, but if you ask patients, they're more interested in knee replacement education and advice. And in fact, they only marginally prioritise drug interventions above complementary therapy. In other words, if you ask different audiences, you get different answers to what you will fund. So we have a wonderful thing in the UK, and is now spreading around the world, called the James Lind Alliance Priority Setting Partnership, which the NIHR is very proud to provide some of the infrastructure funding, but the majority of the activity is provided by our patient groups, our patients and clinical communities. This is bringing together patients and the clinical community in an equal partnership to set research priorities. It's a very long-term deliberative process, and so therefore it can only be used in certain areas, but when it is used, it's really, really powerful. Can move on. And I just wanted to give you an example. This is someone called Irene Keithis. She was involved in our site related priority setting partnership, and she made the point that the idea of bringing together clinicians and patients and carers to discuss research priorities seems obvious, and why shouldn't all those affected have a chance to jointly discuss frustrations? Now, the key thing about Irene is not just that that we think that the work that she helped us with was impactful in terms of the research agenda. It made a huge impact on her personally. And if you think about it, it gave her a sense of control back that she had lost during her experience of suffering with an extremely painful and long-term sight condition. And if you add that up across all of the people, all of the patients and members of the public which are involved in research, then that in itself is huge impact. Number 4 is focus on quality. And we talked a bit about this yesterday, and I think Mona's going to cover a little bit later, that you should only do new research if it's justified by a review of what is already known. And just as a plug, I haven't got time to go into much detail about this, but there's a plug for something called the Evidence-Based Research Network, and I think Hans is in the audience. Hans, wave. So Hans is the guy to talk to about this, and this is about a largely research-orientated, but with wider stakeholders, a community trying to further this particular field. And finally, I wanted to raise focus on openness. So register, if you think about there are many things we can do in this area, but the most important, if you focus on registering all studies, because that gives us an audit trail that we can go back and check whether or not all results have been published in full. And not only is that the right thing to do, but we have a huge problem of publication bias when we're trying to make funding decisions, let alone trying to make clinical decisions on the published literature. And to give you an example of what we do around that, I'll move on from that in the interest of time. We have, for many years, actually had the NIHR Journals Library. So we're fairly unique as a funder in that we actually have our own journal. So anything that is funded by our programs has to publish in the NIHR Journals Library. We make the decision to publish, in effect, when we make that decision to fund. And we're up to our 1000th report for our longest-running program, the Health Technology Assessment Program, and it's now, I think, 1,200 or 1,300 projects. We've just rolled out, and this used to be just a single final report at the end. We've now rolled out a new system called a threaded publication, which releases knowledge along the way. And if the technology...
The NIHR is the world's first health research funder to publish comprehensive accounts of its funded research. We publish all results, whether positive, neutral, or negative. The Journals Library is a valuable open access resource, including 5 peer-reviewed, permanently available journals. At the NIHR Journals Library, we also offer you the whole story on our research. Our final reports don't just provide open access to important findings, but also to the detailed appendices, supporting systematic reviews, trial materials such as patient information leaflets, methodology, protocols, and you can even access other publications and follow-on research. You don't even have to wait for the results to be published. Start following the progress of projects from the day they are contracted, with updates to projects in progress, which continue even after publication of the final report. Let's explore some of the wealth of material on offer. The protocol for the research provides a transparent record of the plans for the project. We also provide subsequent versions should it change over the course of the research. You can view the articles about the research in other journals as and when they publish during the life of the project. Once the research is complete, read the full account in the published journal report. All reports undergo a rigorous editorial process and are free to view and download. The Journals Library aids reproducibility by providing access to project data. Research doesn't end at the completion of the project. You can also find links to both previous and follow-on work. Visit www.journalslibrary.nihr.ac.uk and get the whole story.
So there's a number of reasons why this is important to us. One is, as a public funder, to have that complete account and audit of where we have invested public money. But secondly, this is a mechanism by which we can release knowledge as it is known throughout the life of the project. Whereas traditional conventional funding has to store that all up to the final report at the end. And it also gives us that research integrity orientated audit trail, and we release that protocol at the beginning of the study. So as soon as a study is contracted with us, it ends up with an entry on the NIHR Journals Library. One of the first things that will go up is why we commissioned this piece of research, the lay summary, then the protocol, and then the objects and entities that the research project generates, so people can see and look back about how knowledge was generated and released from the study. So, just to finish up, so the key message for us is that adding value in research is a way of raising the probability of impact of the portfolio for a given cost. That's about connecting it to our purpose and talking in a language which our people understand. I've run through a few areas where I think are the most important areas to start, and that's about setting research priorities with users, only embarking on new research when it's justified by what's already known, register studies, publish research, and some examples of what you might do to get some more information. Thank you very much.